Okay. All right. Hello, everyone. Welcome to First Coast Family Coalition under the umbrella of Foundation Forums for Blindness. We're excited that all of you are able to join us this evening. First Coast Family Coalition is a virtual professional networking opportunity for folks in Jacksonville and surrounding areas to come together once a quarter to showcase different resources in the low vision community, to discuss collaboration opportunities, showcase events, and just really come together to check in with each other. The Foundation Fighting Blindness is happy to host this meeting. The Foundation is the global leader in driving retinal degenerative disease research, and I am Michelle Blaze, Director of Professional Outreach for the Foundation. We're excited about tonight's lineup. Just to give you an overview of what to expect this evening, we're going to kick with just some general welcomes and introductions of our founding member team. And then I'll be handing things over to Chelsea. She will introduce each of our three presenters. Each presenter will have about 10 minutes to provide an introduction and overview of their organization and services for the blind and low vision community locally and beyond. We will then have time for question and answers. We will hold all questions until after all three presentations have completed. And someone does have some background noise. If you are active right now and could mute yourself, Alt-A if you're using JAWS commands, thank you. So once all three presentations have completed, we'll have time for Q&A. If you have a question during the presentation, please feel free to enter that into the chat, or you can hold it until we open up for the question and answer period. After the presentations and Q&A are complete, we will open up to a resource roundtable. So if we have any new attendees or participants and you'd like to hop on and introduce yourself and tell us a little bit about who you are, we'd love to hear from you. If there are others on the call that are routine attendees of First Coast Family Coalition, if you have any upcoming events or updates that you'd like to share, we'll invite you to provide those updates during the resource roundtable. And then we'll have some closing remarks and finish things up. We are recording, so just please note that we are recording this session, and I will send out the recording to all participants and invitees once that recording is cleaned up and edited. If anyone on the call has anything that you want me to share with the Jacksonville community, First Coast Family Coalition community, please email that information to me, and I will include all of those pieces in the email that I send out as follow-up. So before we kick off, I do want to always start by introducing our founding member team. We could not do this without all of you, so very much appreciate all of the work and effort you put in to making these meetings meaningful, to finding presenters and really, extending invitations out to your network. So Adrian Keeve, thank you. Dr. Sandeep Grover, thank you. And Meredith Mason, thank you. If any of you have anything you'd like to say prior to the presentations, I will pause. Please jump in, and if not, we'll move forward.
Just thank everybody for joining today, especially how important education is within the blind and low vision community. So thanks to this lineup, looking forward to hearing what you have to say.
Thank you, Meredith. Okay, barring no further comments, I'm going to go ahead and hand things over to Chelsea. Chelsea, if you'll take the
Oh, I think we lost Michelle, but thank you so much, everyone, for being here. As Michelle mentioned, my name is Chelsea Rohr, and I am super excited to be working with you all in our professional outreach department. It's so great to be working with the Jacksonville community again. So again, thank you guys so much for your support tonight. So without further ado, it is my pleasure to introduce our first speaker, Katrina, who is the Regional Director for Parent and Fit Services for the Florida School for the Deaf and Blind, overseeing statewide outreach, service delivery, and family engagement for infants and young children with hearing or vision loss. So the floor is yours, Katrina, thank you so much for being here tonight with us.
Hi, everybody. Thank you so much for inviting me, Adrienne. She has brought me in to talk to everyone. I am the Jacksonville Regional Coordinator for our parent-infant program for the blind and visually impaired that is housed at the Florida School for the Deaf and Blind. We are funded through the Division of Blind Services, and we provide no cost parent training and support for families in the surrounding 5 counties. We do have 4 going on 5 regions throughout the state of Florida that we oversee. Our Jacksonville region is St. John's, Duval, Nassau, Clay, and Baker counties. And right now we serve about 150 families birth through 5 years old. We have what we call parent advisors that go out to the home and work directly with parents and the children. The children that we serve have to have a vision impairment, but they can have a vision impairment and that be their only criteria, or they can have a vision impairment and other disabilities or syndromes or diagnoses along with that. So we don't have really any limit to the families that we can serve. We work with them through the age of 5. So past early steps, even when they stop serving children, they transition to the school system, we are still involved with those families. We work, like I said, in the home for our children that are in PPACs or the medical daycares or any daycare environment that doesn't already provide vision interventions. We can also go into those environments as well. We work on the evenings and the weekends also. So if there's a child that is in school that is maybe in a preschool ESE program and they're 4 years old, we will work with them in the evenings after school or on the weekends. We also have a lot of family engagement events that we host. So we do one a month. They can be events like this weekend's upcoming Family Cafe or the Connecting the Dots conference that we have in Jacksonville. We also host play dates at local area gyms and parks and libraries for families to get together and meet one another and talk. Our big events each year, though, is our Halloween trunk Jeep or Treat event. So we have a partnership with the Ancient City Jeep Club, and they will come out and decorate their Jeeps for Halloween. They go all out for it, and they get dressed up in a bunch of costumes. And we have a trick or treating event for our families. The children that are in our service, siblings, cousins, come one, come all, do some trick-or-treating with us. And then in the spring, we have a beeping egg hunt. And both of those events are on campus at FSDB. And then also at Christmas time, we rent out a couple of red train trolleys in St. Augustine for families to do a Nights of Lights tour and meet Santa Claus and give out some little presents for them and get their chance to get their picture taken with Santa. Along with those events, we also go to IEP meetings or IFSP meetings with families. We go to eye doctor appointments with families and help explain their diagnosis to them. And we can go to any types of therapy appointments or collaborative meetings to work with other service providers with the families. That is a basic rundown of what we do. All services look a little bit different based on the parents and the family and the child's needs. and we really try to accommodate them and work with the families and what their individualized needs are. And then we work very closely with the Division of Blind Services in hopes of, making sure that our families stay with the Division of Blind Services throughout the lifespan and transitioning into the children's program when they're done.
Awesome. Well, thank you so much, Katrina. That was really, really informative. Next up, we do have Kelly, and Kelly is the Student Support Services Coordinator at Florida State College at Jacksonville, where she promotes equal access for students with disabilities by removing barriers to success through support, training, and community collaboration. Happy to pass it over to you, Kelly.
Thank you, Chelsea. How are you doing tonight? Doing all right?
Yeah, I'm
Thank you.
great.
Thank you for inviting me.
Of course.
Okay, so a little bit about me personally. I am currently I'm a student support coordinator at Florida State College at Jacksonville. I'm at the Beach Boulevard campus, or South Campus. I've been here for about 9 years, and prior to that, I worked 12 years at the vocational rehabilitation, the state of Florida vocational rehabilitation program. It's kind of like sister to Division of Blind Services. So I've been working with people with all types of disability for a while now. I know I don't look that old, but it's been a while. I'm born and raised in Jacksonville, and I plan on, so that's about me. Now, oh, I'm sorry. My background is I, of course, got my AA degree at Florida State College of Jacksonville. Or it used to be FJC back then, but and then I have my bachelor's in psychology from UNF, and then I have a master's in rehab counseling from UNF. So, and then I'm also what they call a CRC, a certified rehab counselor. So you have to take a state board to be a certified rehab counselor. So a little bit about student support. We call ourselves at FSCJ, we call ourselves Student Support Services. There's one of us at every campus. So I'm at South Campus. We have 5 different campuses. There's one at North Campus, Downtown Campus, Kent Campus, Deerwood Campus. So there's we're small but mighty. There's 5 of us, and some of us, like Kent Campus, they cover Kent Campus and Cecil Field, and then North Campus covers North Campus and Nassau Center. So what we do is we're in charge, as Chelsea mentioned, as making sure that we remove any barriers that students have as a result of disability, and we have in order to do that, we have a online accommodations request form. And we need to have the documentation of disability. So that would be for the low vision, the last eye appointment, anything to document what, that they have a disability. So then what we do is they fill out the request form, and then we schedule a meeting with them to review the reform and then kind of develop appropriate accommodations for that particular, everything's individualized. So we listen to what the student needs, especially with the vision, because there's a spectrum, we can have spectrum of the vision. So we try to make sure we listen to what the student needs and kind of accommodate what they need. Some of the, I do know that we do have Fusion, the JAWS and the Zoom text, and CCTV machines that are available in our testing centers for testing, and also in our library learning commons, where students can go study and maybe take advantage of tutoring services. And also we have Fusion in our advising center. So we have access to screen readers and everything where it's needed. In addition to that, I'm sorry, I have to check my notes, make sure I cover everything. We do provide the reader and scribe services. So if a student needs a reader and a scribe, that's for testing. And also for use of college resources for tutoring. So if a student with low vision needs to see a tutor, we provide accessible, access reader scribe for that as well. We provide alternative format books if it's not, we have done books in Braille before. If it's, if it's required, a lot of times now, they have the electronic versions. So, but if we need Braille, we can also do that. Also in large print, we provide that. And also, again, the Braille is for if the electronic version is not available or accessible, we can provide that avail. Another thing that we can maybe offer as accommodation is audio recording and also note takers. So if a student needs somebody to take their notes, then we definitely can make sure that happens. And then also another thing I want to point out is we definitely continue to monitor our website to make sure that it's accessible. I'm actually currently involved in a committee that we're reviewing and making sure that we meet accessibility requirements. So we do that. One of the highlights, though, I do want to highlight is FSCJ has a partnership with the Division of Blind Services, and we have a program called BERC, or the Vision Education and Rehabilitation Center. What it is, it's a community-based rehabilitation program for adults and high school students with the blindness and vision impairment, and it provides specialized training to learn necessary skills to gain independence in home, the workplace, and community, and for the academic reasons. So it provides that. Now it's funded by is made possible by working with the Division of Blind Services, and also FSCJ provides that funding. Some of the core things that they do is adjustment to blindness counseling, assistive technology like adaptive software and stuff like that, laptop and desktop applications, smartphone usage, internet navigation, community outreach, independent living skills. One of the things that I'm very familiar with is they do mobility training. So what they'll do is they'll meet a student at the campus and make sure that they know how to get around the campus. And that's one of the things, like as a support coordinator too, that if I know somebody that needs help to get around campus, if they haven't had the mobility training yet, I will kind of go and assist them to get where they need to be. But it's a really good program, and in order to take advantage of those services, they do have to have a referral through the Division of Blind Services, but it's a very unique and helpful. I know a lot of students with vision, vision and low vision and blindness, that this has really put them on the right path as far as independent living skills and everything like that. So that kind of highlights what we do. Like I said, what we do is, as far as to accommodate students with low vision and blindness, is we talk about what I have to kind of figure out what they can see, what they can't see, and so I have an idea. And then what we do is we work with work with the professors and make sure that we have everything that's available. I actually, for an instance, I have a student who has a degenerative eye disease that is that he's tried to take a lab like two times, and he didn't pass the first time, and he got a D on the second time, and he has to have a lab to get his AA degree. Well, part of the lab is looking through a microscope or looking through a magnifying glass, and when he does that, it changes his vision temporarily. So he's having trouble passing the lab. So what I've done is he's going to take it again later on this semester. And I worked with the professor saying, how can we do this? So actually he's better off taking it actually online, because there's a microscope simulation lab that he can do. And you adjust it not by looking through the actual microscope, but by clicking the keys on the computer. So that allows him to, and that's what the main learning outcome is, right? Is to learn how to use the microscope, how to change the focus and all that stuff. So that's one of the specialized things that I work with. It's an individual basis that we kind of help, that we have to negotiate and determine the most, a reasonable accommodation for them to get through everything. So we're adept and willing to kind of work with the particular students and see what we can do to get them. Our goal is for them to be successful, of course. So we want them to graduate like Meredith's son did. We want them to graduate and be successful. So FSCJ is we're great at providing support. So that's pretty much all I have.
Well, thank you so much, Kelly. It's so great to hear about all the wonderful services being offered by the Student Support Services Center. So it is now my pleasure to introduce our last speaker, Dr. Tara Frazier, who is the Associate Director of the Student Accessibility Center and the Director of the Thrive program for the University of North Florida, ensuring students with disabilities have equal access to education by fostering an inclusive environment through campus partnerships, advocacy, and student support. The floor is all yours, Dr. Frazier. Welcome.
Thank you so much. Kelly, I have to say, I'm so glad you went first because I wrote down a whole bunch of things that I was like, oh, that's a good point. But I also wanted to make sure I didn't overlap and share the same information. So I really appreciate that. Yes, thank you so much for the introduction, Chelsea. I'm honored to be joining with you today. Normally, when I do these share outs, it's a little longer, so I have to really be mindful of time because I know that we can talk about stuff we're passionate about forever. But my primary role, I'm the associate director of our department, and so our department houses several programs, including some state-funded grants. I was a co-PI on receiving the Florida Center for Students with Unique Abilities grant, and the reason why I'm mentioning that is because one of the students in our first cohort also has low vision. And so we've worked a lot with his program and his staff to make sure that all of his materials are accessible. So that very similar to Kelly, my role is very student facing. So we have everything in our office is for supporting students in all of our disability categories. And specifically though, for students who are blind or who have low vision, we have scholarships. We actually have a partnership with the National Federation of the Blind with Florida, and we love being able to promote the scholarships that they offer because it includes students traveling to the state conference, and that's always a highlight that the students really enjoy, getting to share, getting to network, getting to meet professionals in their field, all while advocating on a platform that's promoting success for students with low vision and who are blind. And our office spends a lot of time with assistive technology. And so very similar to Kelly, using things like JAWS, alt text, we actually have a Braille machine in our office, and we have a couple of our staff who are very familiar with using the devices, but depending on the request, we may need to outsource. But we do work a lot more with faculty and making sure that all the course content is accessible. So if there's an online component that the professor has set up using the screen reading software, and that students can access everything with their textbooks that any other student can. We're really intentional about that. And then in our office, we have 26 individual testing rooms, and each of the testing rooms is equipped with all of our assistive technology software. So JAWS, the machines that have the large print and the screens, and it's pretty cool. We even have special lighting in the rooms for students who have light sensitivities and sensory restraints. And so our testing center is where a lot of people come. That being said, we do have 1,400 students registered with our office, and that's from every level, from freshmen all the way up through graduate. We have several students who are in their master's and doctorates right now, still receiving accommodation services with our office. So kind of backtracking a little bit, my area of focus, I'm also a certified rehabilitation counselor. I'm also a certified vocational evaluator. I am incredibly passionate about employment for our students. It's not enough for them to come to UNF and get that degree. It's really important that we are preparing our students for success once they leave our institution. And so I focus a lot of my work with preparing students for learning soft skills. So I have a digital badging initiatives that I have some funding for students to earn credentials while they're at UNF and using our accommodation services. And we've been really lucky to work with a lot of partners in and around our community with internships and making sure that if our student who is receiving accommodations, and I'll use a specific example. We offer something called visual assistance. So if we have a student who is taking a class, and our campus can be quite large, they'll register with our office, and then they'll share their schedule, and we'll actually coordinate to make sure that they have one of our visual assistants. So like a student who is physically going with them, not just in the class, but also navigating campus. And so that's been really, it's actually been twofold. It's really helped students who not only are earning a paid income, but they're also providing a service, and they're also, they're able to connect with peers. And that's been a program that's been really successful in our office. We have students who've changed their majors because of their experience working as visual assistants and providing accommodations. And so we've had a lot of successes with that. You've already mentioned, yes, I am the director of our Thrive program. So that is our program for students with a diagnosis of autism. We do have two students in my program who are legally blind. And so being able to navigate the support services through our supplemental program, working on social skills, working on independent living, cooking is always really fun. And so it's really important for our students that they are receiving those same services, and they're doing it with their peers. So we're not separating students out based on what accommodations they need. And so we actually have a culinary lab on campus where we can reserve the kitchen space, and we can work on independent living skills and work on cooking. The students tend to have a lot of fun making muffins and doing things like that. So I think I've covered everything. Yes, I'm going to pause there because there's always a lot more questions. But all of our scholarships, I do work very closely with vocational rehabilitation, and also with our students who are receiving DBS services. And so I'm kind of the liaison with the paper trail, making sure that whatever vouchers need to go to any departments, that usually filters through my office first. And so just tend to be the kind of person who, oh, I actually do have an answer for that, or I know who we need to call, and being able to troubleshoot and help students navigate some of those processes.
Awesome. Well, thank you so much, Dr. Frazier. And again, thank you to Kelly and Katrina as well. Wonderful presentations, everyone. We are now going to open up for questions for our speakers and any general questions as well.
It's Meredith, and I must have like 20 questions, but I'll keep it short for other people because I don't want to take over the call like I always do. So my first question is actually for Katrina. So you said that you rent the red trolleys to do the tours over Christmas time. Are you finding that the trolleys are actually providing hearing assistance for any of the tour communications? Because I was on a trolley with my best friend who's both deaf and blind, and she could not participate in any of the communication that was coming over through the trolley.
I have not specifically asked them about any hearing assistance for our events. We usually have trolleys specifically reserved. I know they've got speakers in all the different cars that they have. We have had before for participants that needed it, sign language interpreters, but we personally provided that through FSDB. It was not something that was provided through Ripley's or the Red Trolley itself.
Okay, yeah, it's so curious to me, right, that FSDB is headquartered right there. You would think that the community, which draws millions of tourists a year, and I guarantee has lots of people with low hearing, they could have a Bluetooth connection. They could do something.
Yep.
I would love to connect with that organization and say, hey, you could do better considering the community that you're in. So
I do know it's run by the Ripleys, believe it or not. So they would be the people to, if it's the Red Train Trolley, there are several different trolley organizations in St. Augustine. I've seen the Grinch running around at Christmas time giving tours. So
Gotcha.
there are a variety of ones to choose from.
Okay, yeah, I would love to connect with one of those or multiple of those organizations to ask them about, better accommodating. If you can't see what you're looking at and you can't hear what they're talking about, you're not enjoying your experience and you're paying a lot of money to participate.
Yeah, those trolley rides are definitely very expensive. So we've been lucky, we get them kind of like on an off night. We usually go on like a Monday night, to be able to provide that for our families at no cost.
Which is great. I love that. Thank you. And then if you don't mind, one more question. It's for Dr. Fraser. You mentioned the visual assistance program. This is paid through the UNF?
Yes, it does not cost the student anything. And actually, one of my challenges is finding funding when there is no funding. And so I say that there's not a cost, but some semesters will have federal work study students. So they're still getting paid, just not from my budget. Or we
Right.
might have a student who is in the either special education bachelor's program, or they might be in the disability services bachelor's program, and they have clinical and field internships that are required. And for that semester, we may assign them. But I do say this, that isn't their only responsibility. So it's really important for us that they're not just providing, because again, if they're providing visual assistance, that's only one piece of it. We have them working with the student in acquiring accessible materials. What are the steps to, what do I do? So there's a lot of navigating that the students get to experience alongside with their peers.
Is that an opportunity for people in the community outside of the UNF community?
I get asked that a lot. At this time, no, only because anybody who works with the students who are registered with my office do have to go through a level 2 background screening. And we, our internal system, we just switched over to a new platform called Workday, and it takes forever for HR to clear anyone. And so we get a note-taking request, and I have somebody who needs volunteer hours, actually from FSCJ, and I can't get them cleared in time to actually provide the note-taking accommodation until like 12 weeks into the semester. And by that time, it's already way too late. So at this time, no, but it is something that we've been really working more with our partners, specifically with DBS, because they do have scholarship opportunities. And so if there's an academic component tied to it, then we have a bit more flexibility.
Yeah, I was just curious because Nick Mendler's on the line with me, and he's my business partner for I Spy Foundation. We've participated in a career fair with your organization, and we love you guys, obviously. I'd just be curious if your visual assistance program would do internships with organizations, like with companies. Like I run my own company. I would love a visual assistant, by the way. And I'd be curious if, there was internship opportunities.
There definitely are, specifically with the academic programming side. So we have a disabilities services program, and students have to do a 12 credit, a 4-month full-time internship. And it's really important for us to be placing them with community agencies. So we have, some of our students have done full internships with the Center for Independent Living. I know Brooks is on here, and so they've done full internships with organizations so that they're gaining that hands-on experience.
Good to know. Thank you, Dr. Fraser.
Yes.
Thanks for the shout out.
Yes, of course. Always.
And this is Chelsea. We did have a comment from Brooks. She said the school I just graduated from switched over to Workdays too. All the best with that. And I should have mentioned this earlier. Please feel free to put any questions in the chat, come off mute, or email us if any questions pop up later as well. We'd be happy to get you connected with our speakers. I do have a couple questions for Katrina. I am curious, how often are the play dates? And then my other question is, for some of the local-based events, what are some ways that other organizations can support you all?
Our play dates probably end up being about every other month, sprinkled in with the conference attendance that we do. We have at least 6 to 8 in-person meetings, face-to-face meetings a year, spaced out throughout the months. We would love to partner or have other organizations come and share information with our families. The best ones to attend, where we get the most attendance, are the Halloween Jeep Retreat event and our Beeping Egg Hunt, because those are on campus. We get a lot of families that attend those events, and you'll have the most time to have face-to-face interaction with them. You can email me directly. I have a coworker. Her name is Jennifer Flagg, and she coordinates all of our outreach events. One thing I did forget to mention earlier, for the past 2 years, we have hosted a family weekend conference in Orlando. We have brought 30 to 35 families from all of our different regions throughout the state to Orlando for the weekend, and provided we call it Family Matters Conference, and brought in speakers to talk to them and talked about vision impairment, about orientation mobility, self-care for parents. And then we provide childcare for the parents so that they're able to attend the conference and listen to the speakers. We will have 3 or 4 rooms set up, and we break the children up by ages and abilities. We have a sibling group that goes off and kind of does their own thing, and provide them childcare if they'd like it for the day of the conference, so they can really go and be invested and listen to our presenters and meet other families. We're really we strongly believe in connecting our families because they are so isolated, especially when their children are so young, and they are newly diagnosed and trying to find their way. So we really try our best to create open events where families could meet one another. So we're also always looking for people to help sponsor with that conference or to speak at that conference to let families know about their different services and ways that they can be involved in helping their families. So you can either reach out to myself or to Jennifer Flagg, our outreach coordinator, and I can put her information in the chat for you, but she organizes and puts on all of those events that we do.
Thank you so
Katrina.
much, Katrina.
Oh, sorry, Chelsea. Katrina, that event's in April. Is that correct?
That event, yes, in April.
Okay, thank you.
Should have been able to
That was
remember
gonna be
that
my
really
question too,
easily, but
Meredith.
That's okay. I think Adrian was supposed to go, Adrian Keeve, and then unfortunately, due to travel restrictions, she was not able to go. So yeah, I'm recalling it's the first week of April or somewhere in there.
yes, but don't worry, we're going to find a way to bring her back.
She's pretty amazing.
Yeah.
This is
And
Michelle.
Katrina, does that conference?
Oh, go
Sorry, go ahead,
ahead,
Michelle.
Chelsea. I have a question when you're done.
Oh, I was just going to ask, does that conference happen every year in April?
We've only done 2 so far, so it has been consecutive. We are looking at our budget for this coming year. Some version of it is going to be happening again. I'm not sure if it's going to be in Orlando or more locally hosted, but we will have some form of the conference happening. It's still in the early planning stages for that. But yeah, we're planning to keep it as long as the funding is there going every year.
All right, perfect. Thank you.
This is Michelle. I have both a comment and a question. I have to say that I am so heartened by all the adaptations and opportunities for students with vision loss to get the educations that they need and deserve. As probably everyone on this call knows, the underemployment rate for the disability community and therefore the low vision community and blind community is obscene. 70 to 75% underemployment is the last figure I heard. But I heard a couple of you mention adaptation through fusion technology, JAWS technology, which is awesome, along with other adaptations. And obviously, being able to get a good education is a prelude to good employment. So I wanted to ask, that technology is available. Do you also provide training for students who may not know how to utilize JAWS technology or Fusion technology?
I don't mind sharing with our office. Yes, our students, when they first register with our office, they meet with one of our staff and we go through all of the accommodations that they're eligible to receive. And then we go through, so for example, note taking, typically it's a form that the student fills out depending on which class they would like the note taker for. And then it's actually the student who's going to share that note taking request form with their professor. And then that way the student has that autonomy and we're trying to help facilitate that conversation where they're advocating with their faculty member. But for something like, especially with when there's software, we have an assistive technology specialist in our office, and we know that a lot of devices require programs to be installed and software to be installed. So we do an orientation, a one-on-one sit down with the student, not only at the start when they first register with us, but then also each time they're using a new software or a new program. And then every semester we do kind of like a refresher and check in, and that we do more informal, and we do that actually more as a group. And we really encourage our students who are using those softwares and programs to then come back in, and that way, because then they can share like the tricks and like the shortcuts and the stuff that like I just know the formal admin side, but students are always teaching me like, no, if you press these buttons at the same time, it does this. And I'm like, this is better than the training that I'm, spending all this time on. So we do that every semester, but we do that very informally. We do that at the very first week of classes, and it's kind of like drop in as needed for students.
Excellent. Thank you.
Yeah, I also like to talk to the students that I know are really good with the technology and say, hey, this student's having this problem. Can you give us a little hint? I love that. Also, the work program that I mentioned, they do provide, they can get a referral through the Division of Blind Services, and that's one of the things that they do provide the training to use that software as well.
Wonderful. Thank you for sharing.
Yeah, Michelle, this is Adrian. I was going to add to that too. So, like was already mentioned, the Division of Blind Services does pay for training for folks when they need assistive technology training, when they have a vocational goal, or for students who typically have a down the road vocational goal. So if there are students in the public school system, they should also be receiving training for that in the schools.
Excellent. Thank you. All right. Any other questions for our presenters today?
I'll ask a couple if
go ahead, Nick.
on anybody there. So I'll start, gosh, so many questions, but I'll start with number one. It's awesome to see a bunch of UNF Ospreys on here. I'm an alum. I will start with Kelly, and then I have a question for Dr. Fraser after that. But Kelly, so I forget, how many campuses are there for FSCJ? And then you said there's 5 coordinators. Is that every campus, or are there's offices on every campus, or?
So there's, let's see, I think there's 5 campuses and 2 centers. So there's South Campus, North Campus, Kent Campus, and let's see, Downtown Campus. And then there's Deerwood Center, Nassau Center, and Cecil Center. So there's 7. So there's 7, actually 5 campuses and centers.
Okay, so 5 campuses and 2 centers.
Mm-hmm. Yeah.
Sorry,
yeah.
Big.
We're big. We're spread out. Like we're over, Cecil Center's way out west, and we go into to Nassau Center's over like in Nassau County. There's 5 coordinators. So like I cover just south. There we have a coordinator at Deerwood. At Kent Campus, the coordinator covers Kent Campus and Cecil. And then at North Campus, she covers North Campus and Nassau. And then the downtown coordinator just covers downtown.
Got it. Okay. And then I just wanted to say, I love the story about the lab and the microscope. I think that is just a beautiful example of adaptivity and just creativeness to, make sure there's a way for somebody to go through and get their education, and just say thank you for that. So
yeah.
And then I had a question for Dr. Fraser. the 1,400 students,
Yes.
what is that population set? Is that, what's the blind low vision within that, or is
I
that?
knew somebody was going to ask me that. If you give me, because I was trying to look up my most recent, I'm the one who prepares the annual report, but if you give me like 2 more minutes, I just have to log in and do the security thing, but I'll give you an accurate answer for that.
Okay, yeah, that's fine. And then I was, I know you're digging stuff up. So I'll try to fill the gap with the question and talk slow while you do your thing. Yeah, so we have 2 current interns with I Spy Foundation right now through UNF, through communications department and the arts department, which have been amazing. But I'm curious how we could be involved. Do you guys use Handshake, or is it a separate program for, you know, the disability office, stuff like that? Or curious on that, because you mentioned some of it to Meredith, and I was trying to track with everything.
So, well, I'm actually the contact for our office when it comes to Handshake. So I make sure all like the career fairs. So depending on the college, I'll use psychology as an example. The psychology does a practicum and internship career fair. And so they'll bring in and I'm surprised, have you ever attended one of those? Because you guys would be perfect at the psychology, like the practicum fair. So that's through Handshake. But then we have the more academic side. So specifically the disability services, the academic program of study, part of the coursework requires them to have community engagement experience. And that's where that internship piece becomes very specific to that program of study. And I already made a note and I wrote down your names to connect you with the program director, because I think that seems like it's a very good fit for y'all to be working together.
Yeah, no, I've been super impressed with what UNF is pumping out, and again, it's going to be amazing for our community. All the stuff that we're going to share soon, and I'm just filling gaps until
I just got to scroll down to it.
Okay, and I'm gonna guess, and let's have fun with it. Meredith, why don't you guess first? What do you think?
Well, we keep saying 3%, right?
Yeah, that's where I was going to go with it. 3% of 1,400.
Now I have to do my math.
All right, let's just say I'm going to say 75.
I'm saying 45.
Well, I was going to say, so we actually have, because I'm the one who pulls this data. So students who have the primary disability diagnosis of blindness or low vision is 48. So you might win a drink right there. And then students who have a secondary, they may have low vision marked as a secondary. So it means, they just have another, typically it's a health impairment that is listed as their primary, and that's another 23. So 40, what did I say, 48 plus 23 is
71.
71. So you were actually very close, Nick.
Well, we're both really close. So I think,
yeah.
So it's we try to understand numbers because we try to do everything back by data. So, but yeah, thank you for that, Dr. Fraser. Those were my 2 questions, and I will let other people speak. So.
Thanks, Nick. Any other questions for our presenters?
I'll make one more comment. Just back to Kelly about the lab, and Nick, thanks for bringing up that comment. I do want to say that Flagler College, which is the original school my child was at, Kelly, the one that you helped, they also accommodated. It wasn't a vision issue, but it was a remote schooling situation where they conducted a biology lab the best way they could, which was basically taking a camera in the classroom and holding it up over a microscope. So again, shout out to anybody who uses any kind of accommodation for any disability, not just low vision and blindness. But again, thank you to all the education, academia, curriculums, everything you all do is unbelievable. I have 2 master's degrees myself. I was not low vision when I was in school. I'm grateful for that because I'm 52 years old. But I'll tell you now, the students who are in school who do live with a low vision or blindness situation, shout out to everybody who accommodates all of them. Thank you for that.
Absolutely. I completely agree, Meredith. So thank you for your sentiments. We were supposed to have a 4th presenter, James Warkin from Blind Institute of Technology, and hopefully we'll be able to bring him on board at one of our next forums. But BIT is an organization that I would encourage our 3 presenters and anybody else on the call to explore. They've received a large grant and have created some apprenticeship programs for individuals with disabilities to get them gainfully employed in good careers, high-paying professional careers with Fortune 100, Fortune 500 companies, and they've expanded out their academic offerings. So we'll be sure to invite all of you, but those may be some opportunities for your students as they're approaching employment. So just a little shout out to BIT. So, okay, well, we have about, I think, 10 minutes left if my eyes are not failing me. And so I do want to open up for kind of a resource roundtable. I want to invite anybody who wasn't presenting this evening, and thanks again to all of our presenters, excellent information. But anybody that wasn't presenting who is either a new attendee or participant, or a attendee, participant, or presenter, if you have anything you would like to share, if you'd like to introduce yourself, any events, the floor is yours. So please hop on in and let us know what's upcoming or what we need to know about you and your organization.
Can everybody hear me? This is Brooks.
Yes.
Okay, I'm driving, so I just wasn't sure if my road noise was in the background. So I, as Dr. Fraser mentioned, am from Center for Independent Living, or still Jacksonville. I think there are about 5 or 6 of you here that know me and know me well. And so, hi. But I wanted to tell all of you, especially the 5 or 6 of you that have known me for quite a while, that I will be leaving SIL and FAST. I took well, first of all, I graduated from my master's in social work this May. And I am fortunate and super blessed to have gotten a position down in South Florida as a counselor for the deaf and hard of hearing, or as a mental health counselor. So I'm super excited about that, but that does mean that I'll be leaving FAST and SIL, unfortunately. And I won't get to see y'all's faces, so I'm sad about it, but I'm excited for everything ahead. And I just wanted to say thank you so much, and to kind of spread the word around in the community that I'm leaving. If you wanted to go ahead and do that, that's okay. And my last day will be June 23rd, and then I'll move down to South Florida and then start that new position in hopefully mid-July.
Congratulations, Brooks. We're gonna miss you.
Thank you, Adrienne. I'm gonna miss y'all too.
Yes, congratulations, Brooks. That's wonderful news for you. You are going to be missed.
Thank you so much.
And I
know I'm gonna miss you guys too.
I know, but exciting.
Go ahead.
Very exciting for you. Do you know if are they actively looking for someone to complete your position when you
replace
leave?
me? So I am, yeah, I know, right? So I am hoping to be involved in that process as much as I can in, the week and a half that I have left. I'm hoping that mine, or the family that I babysit for, they have an older daughter who, through speaking with her about it, she seemed really interested in it. So I'm hoping that we can maybe bring her on maybe for an interview, but that unfortunately isn't up to me. But that's
right. No, I was just wondering if,
yeah,
if they will spread the word about, how we contact FAST in the future, for
right.
prices and whatnot.
Right. So I know that before I got hired, the girl that did it before me, I guess she just forwarded all of her stuff to Stephanie Monroe, who was our boss. And so I would assume, I haven't talked to Stephanie about it yet, but I would assume you just contact her after that June 23rd date. And then at the very least, there's that info@SIL Jacksonville email. I know that a lot of requests come through there, but Stephanie should be able to get a hold of all of those requests, and then she can forward them to headquarters. But she, I know she's lended a hand in fulfilling those requests before and kind of bridging the gap until they find a new person. So I hope that answers your question. I'm sorry I don't have an answer for you yet.
No, that of course not. So I also just wanted to say hello to everybody. It's great to see everybody. I'm Noelle Guidry from Inside OT Services, providing mobile outpatient low vision occupational therapy in Northeast Florida. So it's nice to be on tonight, and thank you everybody who spoke tonight.
Thank you for joining, Noelle.
Good evening. This is Adrian. I have an event that I can share about briefly. So there are a few people on here that I don't know, and I'm the Independent Living and Children's Program Specialist with the Division of Blind Services in Jacksonville. And I'm also the chapter president for the Foundation Fighting Blindness Jacksonville chapter. There is a Disability Expo, a Disability and Adaptive Recreation Expo coming up next month, July 26th. That's a Saturday at the Prime Osborne Convention Center from 10 to 3. It's free to attend. Lunch is included for those who register. You can visit jaxada.com to register. That's jaxada.com to register.
Excellent, Adrian. Thank you for sharing. If you'll send me that information, I can include that in the follow-up email that goes out to everyone as well.
Yep, I will.
Yep.
And I'll be there with you, Adrian, right? You got me down for that?
Yes. Yes. Thank you, Nick.
You're welcome. I have something too. So Nick Mindler, I Spy Foundation. Again, most of you know me already. Some of you don't. And we've created ispy.org, which is the largest digital directory for the blind and low vision community. We are working right now to build out our Jacksonville hub. And part of that is some of the sponsorship stuff that we're doing. One event I wanted to mention is going to be on September 18th, Thursday, from 7 to 9. We formed a sponsorship with Ellie Mental Health in Ponte Vedra. They have specific, and actually Noelle is part of that training, where they have trained their therapists to really understand our community better, which is why it's such an amazing partnership. But one thing that we wanted to do with iSpy is to create a real approachable social environment where people could come. You can say it's kind of a support group, but we're really framing it as a place to come and just communicate and share and meet people from the community. And so our first iSpy social, again, will be on the 18th of September. We're going to call it Mocktails and Mingle. Again, we can't do drinks or anything in a therapist's office, but we are going to have fun with it, have some games, interact, and that is on the books now. And so I will get information over to you, Michelle, once we have like our flyer and all that good stuff created. And then we've got some other events, and that will be a series. So we're pushing that into 2026 as well, but that'll be our first one. And then we've got some other events coming, but I'll have more information on those, as we get to probably the next call, I'm guessing.
Excellent, Nick. Thank you for sharing.
Thanks.
And this is Chelsea. I just want to say hi, Nick, Adrian, and Noelle. Thank you so much for sharing. I also wanted to congratulate Brooks. That is super exciting. Whenever you get the chance, could you also send over Stephanie's contact information?
I will, yeah. I have about 2 minutes or so until I pull into where I'm going. So I will shoot that over the chat. Or if you want me to, I can just tell you her email now and maybe somebody could write it in the chat for me.
Absolutely. Yeah, if you want to drop it in the chat and I will get the information from you. And we'd also love to get you connected with our Southern Florida community as well. So whenever you're ready for that, just let us know.
Yeah, absolutely. Yeah, I'll drop her email and then I'll put my personal number in the chat. Everybody knows, but just FYI, personal number, not office number, but anyway. Yeah, that works. Thanks.
Perfect. Thanks so much, Brooks. Again, congratulations.
And I know we're about done. I just have a quick comment if nobody else has anything else they wanted to share. Okay. So this is Adrienne again, and I just wanted to share briefly that I am a UNF graduate. I did take advantage of the disability services that were available. I went to college right out of high school and dropped out because I didn't have the right accommodations. And when I went back to school, I got the right accommodations, got connected to Division of Blind Services, attended UNF, and graduated with high honors. So those services make a huge difference. Everybody at UNF was wonderful. Everything was pretty seamless. When I made my requests, I was able to get whatever I needed to be successful in school. So it does make a huge difference. And I actually took as an accommodation a math class online through FSCJ because it's a lot easier for someone with low vision to take a math class online than it is to try and see the board. So I was able to do that through FSCJ. So thank you both.
Adrienne, thanks for sharing. Those testimonies are always powerful. So, okay, well, this is Michelle Blaze. We are coming up to the end of our meeting. Just a heads up that our next First Coast Family Coalition meeting will be in September, and our founding member team will be meeting the next couple of weeks to nail down a date that will be posted on the First Coast Family Coalition webpage. You can access it by going to fightingblindness.org, click on the For Eye Care Professionals tab, and then Foundation Forums for Blindness, and you'll see the link there. All recordings are there. All of our founding members are there. Next meeting dates are there, and professional resources are listed. So if you have anyone that you would like to invite to participate in First Coast Family Coalition, please do reach out to us and let us know. We also invite you to check out all of the wonderful research that's underway and funded in large part by the Foundation Fighting Blindness for people with retinal degenerative diseases. There are more than 50 clinical trials underway in the space, a multitude of different therapeutic modalities. And so we invite you to check out all of the research. We offer no-cost genetic testing through the foundation and a number of other resources. So if I can help with any information, please reach out to me. Again, Michelle Blaze, and forward to seeing all of you in September. Thanks so much for joining us this evening. Good night.
Good night. Thank
Thanks,
you.
everybody.
Good night,
Thank you.
everybody.
Thank you.
Bye.